Hi everyone, I am Mrs. Deepika Sri from the Department of Physician Assistant. Now I am going to tell about the general and local signs of the fractures. So using this we can diagnose whether the fracture is occurred or not. So in general sign, for the first follow ABC. Look for and if necessary attend to. First thing, A means airway obstruction, B means breathing problems, C means circulatory problems, and C for cervical spine injury. The secondary survey examine the main injury, ascertain the type of fracture, classify, plan a management protocol, and look out for complications. It will also be necessary to exclude other previously unsuspected injuries. Which means the general sense we have to first think about A basis airway, if there is any airway obstructions or breathing problems or circulatory problems, and the cervical injury. So first we should not move the patients like our wish. We have to ensure that if there is no A basis, which means it means then we can move on to the other procedures. This is the general signs. Another one is local sign. In that local sign, familiar headings of clinical examination should be always be considered. Damage to arteries, nerves or ligaments may be overlooked. A systematic approach is always helpful. Examine the most obvious injury part. Test for artery and vein damage. Look for associated injury in the region. Look for associated injury in a distance part. So this is the local sign. First look for, we saw like look for associated injury in the region, which means how we can look that for swelling, bruising or some deformities is there, means if there is the injury is confirmed, and examine whether the skin is intact or not. Should not always the posture of the distal extremities and the color of the skin, which may lead to any artery bleed or vein bleed, and there may be any cuttage of the blood vessels. And the injury part is gently palpated for localized tenderness. So we have to gently palpate the injury part. If when we touch, if the patients feel the pain is aggravated, means it is called as tenderness. So we have to check whether the tenderness is there or not. And the common and characteristics associated injuries should also be felt for even if the patient does not complain of them. And then vascular and peripheral nerve abnormality should be tested for both before and after treatment. So this is the main thing we have to look on a field. And another one is move. The crepitus and abnormal movement may be present. More important to ascertain if the patient can move the joints distal to the injury. This is the look, feel, move is a very important during the traumatic time. Another diagnostic method is X-ray. The X-ray is the major helpful diagnostic method, and the X-ray is mandatory for the bone injuries. There are two rules is there. One is two views, another one is two limbs. The fracture or the dislocated may be seen on a single X-ray flow, and at least two views, anterior, posterior and lateral must be taken. The two limbs in children, the appearance of the immature epiphysis may confuse the diagnosis of the fracture. X-ray of the uninjured limb need to be comparison. And another one is two joints, two injuries, two occasions. These are the main thing we have to assess. And the special images are also there. The special images means computed tomography, that means CT, may be helpful in the lesion of the spine or for the complex joint fractures, help in the accurate visualizing of the fractures in a difficult set such as the calcaneum and the acetabulum. And then MRI. MRI means magnetic resonance imaging, may be the only way to showing whether the fracture vertebra is treating to compress the spinal cord. Another one is radioisotopic scanning, is helpful in diagnosing the suspected stress fractures or other undisplaced fractures. So these are the main thing. CT, X-ray, MRI and radioisotopic scanning is for to identify and the location and the stages of the injury we have to know using this. And the clinical features. Clinical features means it means paresthesia or numbness on the injured site. Injured limb is either cold or it looks like pale or slightly cyanosed, which means and then weak or absent pulse, which means the injury is traumatic. So these are the points for diagnosis of the fractured site. Thank you all.